Self-Love, Self-Healing, a unique program that's specially designed for you to take care of your holistic health and total well-being. In short, heal yourself, love your life, now and forevermore.
Good morning, Malaysia. Welcome to Duriya Nation once again with Dr. Avnish Shukla and my friend Shrub.
Hi, Dr. Shukla.
Hi, Shrub. How are you?
Yeah, right. Good morning.
Good. So, I think it's a long
break for me.
Long break, yeah. I think people have celebrated Deepavali.
Yeah.
And,
Happy belated Deepavali to all. Yeah.
Yes, to everyone.
Yeah.
And I think slowly we are now reaching to the end of our year.
Yes,
year 2019.
Yes, almost.
It's now just a couple of more months remain.
Yes, 1 month plus remain. Yeah.
Yeah. So we want to give as much as good things we can or valuable things we can conclude in this year.
Yeah, good.
Before
Good.
we complete the year.
Correct.
So in that regards, today we have a very exciting topic. That's the ENT. Before we were thinking about this topic, definitely there are a lot of ailments nowadays, with children's or even the adulthood also they are suffering with. So first we would like to tell our audience what is ENT, and we will slowly let them know also that what homeopathy can do with that.
Okay.
And,
what does the ENT mean actually, Dr. Shukla?
It's ear, nose and throat.
Okay.
So when we have a specialist in hospitals,
Yes.
the ENT specialist.
Okay.
So they are specialized only, they study only about ear, nose and throat. And they're known as a surgeons. So they will do related surgeries of these three parts of the body. Yeah. And it's a very deep and vast knowledge about ENT.
Very specialized.
Yeah,
knowledge,
very specialized, what do you call the topic. Yeah. So there are a lot of complaints in children, especially young children.
Okay.
We have notified nowadays, and time to time we notice that immune system has played important role in development of ENT problems.
Why, Dr. Shukla? Why it is so?
These are very sensitive areas, ear, nose and throat. And you know what is unique about it? All three things having an openings or open orifice.
Okay, yeah.
Right? Open outlets, right?
Yeah.
So, nose, you smell openly. Mouth, you eat or you breathe sometimes also from there, and nose also will be used. In children cases, when their nose is packed, they start breathing from mouth.
Yeah.
Right?
True.
Ear, you can't stop the cold air to move in, right? And when you have already existed the cold inside, then you find that, it's already now, suffering with the cold, suffering with cough, suffering with ear pain, or ear infections. So this is very common thing that all three places, ear, nose and throat, having a open outlet.
Okay.
Being open outlet, it's very easy to get infected.
Yeah.
And prone to get infections, right? In children cases, children are not yet 100% immune. Their immune system is developing, right?
Still developing.
Still developing. So that is where we find there fluctuates a lot of ENT problems.
I for myself, I have sinus since I was young, small. And then I went through 2 operations. ENT specialist, so-called.
Right.
But it didn't cure my sinus. So what is this, the thing behind all this? Normally, those who have sinus, children or adults, they always encourage or advise to go for operation. But after being operated, they still come back with the sinus as usual.
Right.
Why it is so, Dr. Shukla?
Yeah. See, again, the operation is last resort, as we believe as homeopath, especially in cases of ear, nose and throat. One by one, we will tackle the case. But before that, I'll answer your question.
Okay.
That why we should not choose as a first resort or first thing as a surgery. Because as a child, when the child is growing and you have tonsils inside, you have adenoids inside, you have some other glandular system, lymphatic system inside the body. These all things are a part of children immune system.
Okay.
If you start removing these parts slowly, when you do the operations, you will definitely disturb the system. When you disturb the system, child immune will be disturbed.
Yeah.
So then whole life he may suffer probably. And that's one of the reason why the surgeries in early age group, when they do, it is not successful. And children's or the people will get later again in the later life, similar type of problem.
Yeah.
For example, nasal polyp. There is a small polyp or swelling happen to the nasal septum. And there could be multiple causation for it or ailment from. Most of it suffered because of the allergic condition.
Allergic.
Yeah. And those allergies are accumulating and inflaming the nasal septum in a form of polyp.
Okay.
And doctors will suggest, ENT surgeons will suggest to operate it. But many failure cases, after 2 or 3 years of the time, again, because the allergy is still there. So when allergy is there, the same phenomena will again take place. And after 3 years again you have the another same type of problem. And with the previous surgery, the cavitation or certain other types of complications are there. So is situation worsen comparing to 5 years before the surgery, how it was, and now how it is, and doctor again suggests for the second surgery.
Yeah.
So there are a lot of such type of failure cases where surgery is not recommended, especially when it comes to ENT cases, right?
Okay.
I am not against the surgery, but I am saying if it is really required, even we talking further like throat problems. So we have tonsils, and children's, they love to eat ice creams. They love to go for the, all those cold and chili and savory and strawberries, and how they're fond of, they want to eat whenever and whatever the things they want, regardless of the weather, heat, cold. That's where the childhood is and the children's are.
Yeah, true.
Sometimes their immune system is still not enough to fight, and they're trapped with those type of infections, throat infections, and that leads towards the tonsillitis or inflammation in tonsil glands. It's both sides situated gland, and sometimes it gets swollen so much that it is completely blocked.
Okay.
The moment it blocks, the child can't swallow properly. He will feel the pain while deglutition or while swallowing.
Okay.
And of course, there are externally also
life
pain.
endangering like that?
I'm sorry?
Life endangering?
No, not really. It is every children you will find more or less having the inflammation into the tonsillitis.
Okay.
In fact, in GP practice, we say tonsillitis is one of the bread and butter for GPs.
Okay.
So not in other way I'm trying to say, but I'm saying that this is very common fluctuations in children.
Children nowadays.
Yeah,
but
nowadays.
In my days, I don't think it's quite that popular. Right?
Maybe the technology has played an important role here in today's era, where the mothers and the parents have become more aware of it, the what is called tonsils.
Okay.
Probably those era we're not aware of.
Yeah.
If we talk 50 years before, the mothers are not really bothered about what is called tonsils.
True.
But nowadays you see that even child himself knows what is tonsil, where it is situated, how does it look like,
True.
when it get red, what is happening to him. So they themselves are so expressive, and they will just let us know what is happening. 3 years old, 5 years old kids, they are so expressive themselves. And another thing is Mr. Google, who has brought every knowledge to the people.
So medical advisor.
Exactly.
Google,
medical advisor. True. So such conditions like tonsils, at early inflammatory stage, there are very good remedies in homeopathy which can claim within 2 to 3 days time child will be perfectly fine. Within 24 hours, you will find the child can swallow without pain.
Okay, that's good.
Fever will be gone.
Okay.
So there is no need for giving the antibiotic syrup and all those things. Whether the child is 6 months old or the 6 years old. Right. Furthermore, if you go for sometimes it is not being treated well, and slowly it has developed the abscess. So we say peritonsillar abscess. Once the abscess forms, the top of the tonsil will become yellow color because of that abscess. Abscess is the pus formation, right? So, but there are chances that we can heal the abscess as long as it has not gone into the severe condition.
Yeah.
Sometimes these severe conditions are also associated with further complication of ear and the nose also.
Oh, okay.
If those things are not involved, probably it doesn't require the antibiotics and can manage. We have treated successfully such cases where the surgery was recommended.
But again,
yes,
without that.
And after 6 weeks only, we can see the proper clear picture. Or even you can have an X-ray and you can understand what is happening to the abscess, how it is drying up, how it is shrinking the tonsil glands. So all those things. And symptomatically, patient is feeling much better.
Yes, the most important they are feeling.
Yeah. And immune is boosted. And what is the best part? Reoccurrence of such symptoms chances are getting lesser and lesser while treating with homeopathy. And I'm not saying that you will not get again, our child will not suffer again with the tonsillitis, but symptoms will be more milder.
Okay.
And it will not have a severity of the disease. Intensity of the pain and intensity of the disease will be reduced further. Right? So this is something which is very unique with treating with homeopathy. So we talk about the ear, we talk about the throat. Now we talk about the nose and we talk about the throat. Let's talk about the ear as well.
Okay.
Any common symptoms? Do you think that the ear children are suffering nowadays lot? Have you come across?
Water enter into the ears, maybe?
Yes, they love to go for swimming.
Yeah, swimming, yes.
And after swimming, the ear pain.
Yes.
And then
block,
ear block, or sometimes they have the resonance, or sometimes they have a problem with the earache. Or otorrhea. Otorrhea means the pus secretion or discharges from the ear.
Oh, I see.
So mostly again it is due to the cold or some type of infections.
Oh, okay.
Very bad remedies like our antibiotics being given to the children. They suspect that child may have a infection. So they try to give some medicines to clear the infection. But again, if this is a tendency to forming the pus every now and then, so antibiotic effects will be not lasting longer, and child may suffer again after 3 weeks, after 2 weeks, again and again. And I noticed that ear pain is very, very terrifying. And it's.
Yes.
I would love to share you one incident of my childhood, and where I was associated with my father, who is also a homeopathic doctor.
Yes.
I may be in 15 years old and I was studying in my 8th standard. So it so happened that my father used to be in morning hours in a clinic, and then after that I will be sitting there just as a receptionist. So I was there, and one lady brought a kid, and she said that my child last 2 days having this ear pain and is intentionally painful, and where is the doctor? So I said, doctor already left for the day. He will be back in evening only. And then she said, any other remedy can you give it to me right now, because we don't want to give any other medicine, we want to give homeopathy only. So since childhood I am attached with my dad, and especially to homeopathy and the homeopathic prescriptions. So I always there as a helper of preparing the medicines. So I know that he has prescribed many times for ear pain in children and adult people, pulsatilla. Pulsatilla is one of the remedy, where we just confirm few symptoms. Number one, that how does the pain started.
I see.
So it could be the cold which the child had, or maybe the cold exposure. And second thing, the discharges, which is very unique, that yellow type of like a mustard, a mustard oil which is dripping down from the ear. So I can see that yellowishness in the discharges because the child was there. And so I thought first to call dad and ask him that, shall I give? And I did try, in fact, from the landline, but those days we don't have a mobile, so we have to call landline to landline. So, but he was not there. So I have no option to talk.
It's quite far also from your house to the clinic?
Actually we were not having, he was not reached to house actually. So it was far, definitely. So I can't leave and go and get the information. But I thought maybe he reached to home, so I called, but then even he was not there. So maybe he was not yet reached. So I have no option, but I told her, okay, I'm giving you one medicine and you will start giving the child and maybe tomorrow morning you again come or after 2 days. So those days we used to just give 2 days medicine. In acute conditions, only 2 days.
Okay.
So even antibiotic works for 5 days.
Oh, yeah, you have to finish it. Yeah.
Homeopathy only 2 days.
Yes.
Not to say against the antibiotics, but then I'm saying that how fast it can push your immune system to heal you.
Yes.
So I gave pulsatilla, and specific potency in homeopathy plays a very important role. Potency. So I gave in 6 potency. And I told that, okay, give few times a day. And so after 2 days she came. But not for the child. She came for some other complaint of her. And then she did mention that my child is better. That medicine was good. Okay. See, I was not a doctor that time.
Yeah.
It was just a past prescriptions of my dad, which I have seen in treating the child's ear pain or such type of otorrhea where the discharges are more like a yellow color discharges, mustard, bland discharges. It works wonderfully.
Yes.
And child was sleeping well. Then the mother explained everything decently that it was awesome. Within 2 days everything is fine. Shall I continue the more medicine or just stop because child has no problem anymore?
Oh, that's good. That's good.
Yeah.
You talk about potency. What does it mean actually?
The power of the medicine.
How to induce or increase the power of that homeopathic medicine?
Basically the dilutions. Okay. When we do more dilutions, and there is a process nowadays, we have machines in pharmaceutical industry. We will use those machines to prepare the serial dilutions.
Okay.
So in serial dilutions, like you got the 1 potency. So to prepare the 2 potency, we will take a 1 part of this 1 potency
original
and then 99 part of the other or certain part of the vehicle. What we're using to dilute it.
Okay.
It could be distilled water, it could be ethyl alcohol, it could be any other type of substance.
Okay. The more diluted it, the more powerful it is. Why is it so?
Okay, this goes back to another topic which is very unique with the quantum physics.
Okay.
And where we're talking about the atomic energy, we're talking about the nanoparticles. Nanoparticles. So as the nanoparticles are getting more and more stronger, being diluted, getting more and more potent, they work as an energy form.
Okay.
And energy can be generated in many dimensions. Like when you have something which is in energy bombs or in energy forms, you can use it in any way or any forms.
Okay.
But if you have a formed tablet or you have a formed material science, there is a limited scope for it. Okay. You may have a particular part to hail that. And that's where we find when the material things we use, we have a limited scope. But here in homeopathy, like today one of friend, he said, okay, well, doctor, you are treating my high blood pressure, I know. But suddenly I realized that there was a mark on my face which is getting shrink.
Oh.
How come?
Oh.
I was not treating his mark. I was treating his high blood pressure.
Yeah.
And then he said, I noticed that it was big. Now it's become shrink.
Okay.
I was dumbfounded. I mean, of course, I know that how does homeopathy work. Homeopathy is treating the immune system.
Okay, the whole body.
Yes. So the energy will be going to each part of your body, each cell of your body. And that's where you find the holistic outcome. And holistic outcome is that, oh yeah, my stool is fine. Yes, my urine is better. I'm no more having the incontinence. Yes, headache has no more. It has reduced my phlegm also. Yeah, I don't get giddiness anymore. I do feel energetic. See, not only that person saying that, oh doctor, my liver is better because the report shows. Okay. No, liver will be definitely outcome, but overall the well-being is perfectly fine. And this only possible because the form of energy we are giving, which is potent. And it will trigger the inner immune system.
Self-healing
system of the body. Okay. And that's where you find the cells getting vibrated. More healthy energy is going inside, and more healthy cells will be getting strengthened. And we can just kick off the disease power.
Okay.
So it looks like a very philosophical
and mysterious as well.
Yeah, but as we know that whether you see or don't see, the thing still exists.
Yeah.
Right?
Yeah.
We can't see from where the cold coming from the air condition.
Yes.
But you feel, I feel
but
there's
it has
cold.
been tested by the founder
Yes,
himself, right?
yes. And even now, many of the Nobel laureate also, they are trying to prove that how does this mystery work? Yeah. How does this homeopathy work? Because it's already sustained more than 250 years. Right? From 17th century till now.
Yes.
So, where the truth lies, that's something which is not mysterious, but just not aware of. Just not aware of.
Is there still great debate between Western medical school and homeopathy? They are debating, whether they call sometimes homeopathy as a pseudoscience, I heard a lot about this kind of thing.
Good question. And yes, there are sometimes, depending on which part of the world we are belong to and where we dominate. Right, because when we talk about India, maybe people will talk about these things, but in all their own community, they won't directly say anything to homeopath that your medicines are not working or no, this is fake or all these things. But maybe in other continent or other part of the world where the rules and legislations or litigations are not very clear, where these pathies or homeopathy and other alternative medicines are fake, or they may daringly or can say these things that it's not right. But we don't go very far. Homeopathy in Malaysia has been, very well established.
Getting mainstream.
Yes, getting mainstream, and Ministry of Health has taken care. Well, and last 10 years we have already working progressively. To make it more better. And coming 5 years, you find the establishment of homeopathy and other alternative therapies into the government hospitals with the government hospital doctors. So it's a shaking hand with the modern medicine and trying to be a part of it to complete them.
I see.
And we trying to be a win-win, like complement to each other. As I mentioned, like the nasal polyp. So if homeopathic medicines can dissolve and shrink the nasal polyp, why you need to chop small babies and 3 years, 5 years, 10 years old people, or even the adult people as well, right? So such type where we need an immune modulation. Why we need to do the structure modulation, right? When you need an internal immune modulation, so then the external modulation can be better. So this is what is basically is going on. So it's no more that myth that the doctors don't understand. It's just that they don't want to understand. So that's a different scenario. And it's our moral duty to teach them, because we have studied homeopathy, not they. So they are right on the path. And maybe slowly in a curriculum of medicine, we also add on. There is a chapter module called alternative medicine in medical curriculum. And I think, if not mistaken, for one semester they study for a few hours in a week.
Homeopathy, Chinese medicine.
Yes, all. And I was one of the lecturers in Cybergia was teaching these topics to the medical students and to the pharmacy students. Right? So they are aware of, but not been given a more advantage or more value to these things. Right? So once the system will be up, I think they will definitely start recognizing it.
True.
So, Shrab, coming back to ENT, do you think that anything which we should also take care of so that we don't get doctors very often?
There's a traditional method that they use, a pot to wash your nose.
Oh, yes, neti,
Neti. Can you explain about that? I tried that.
Really. Well, many of them, they do that, and water, nowadays, in fact, I see the mothers, they will just take a water in a syringe, a syringe, and then push inside the one nostrils, and from the other nostrils, the mucus will come out.
Yes.
And they try to clean that. It be bit uncomfortable while using the water inside this way. But I think when there's a blockage, and the nose blocks when it snuffles, the mothers really suffer, because the child can't breathe properly.
Can't sleep well.
Can't sleep well properly. They are irritated, especially very young babies, where you don't know what they want. and the child is just gasping or having the mouth open and trying to breathe from the mouth. Sometimes even the color also red, from red it becomes to blue. These all conditions are really helpful in immediate effect. And majority of time doctors are using the steroidal based spray.
And
spray.
Even nasal spray also steroid.
Nasal sprays.
Now of course there's some salt water one. But I find very hard to find now.
We have homeopathic nasal spray also. And again the same pulsatilla medicine has been used for that as well. And it is steroid free. And I found effective. Some families are using for the children and for the adults as well. It's quite effective. And what I suggest that again is a problem of inner body and the immune cells. So the moment we give the right medicine to treat that part, you find the sniffles and nose block, all those things slowly will subside.
And how about some usage of some like essential oil? Peppermint. I think I find
peppermint is good. And lavender cools down, down, and then RC. RC is also quite good for the infections and all. And even sometimes the eucalyptus that also also opens up the nose and all. So essential oils, definitely it works wonders. You can diffuse. And another thing in concern with the nose block, you can use the peppermint in a warm water or the boiled water and steam it through the nose. If the child
put a towel on the head,
cover the head and that part where
I tried that before. I think when I was in Nepal, of having very serious flu for 1 month. Every day almost like I was doing that. I remember that.
That is also very fast track opening the nostrils.
When you have a fever together with a nose block, very difficult.
Certain things maybe I would like to tell our audience that what they should not do when they are having ENT problems. Number one, whenever they get the nose block, do not harsh blow. When you do the blowing very harshly, you are eroding internally. The mucous membranes are very soft. And since the nose is also connected with the ear, so it can destroy the eardrum. Right? So that is number one. Number two, do not poke inside anything that you don't know what is happening inside if it's blocked. So don't use any sharp instrument to cut or pit or anything without any guidance of people, medical people. And ear, especially the ear, when you get the itchiness, you want to just put whatever you have in your hand. Even sometimes I notice they will use the pen. And the pen is too pokey, it can just so sharp. It can just hurt inside. Especially children, whatever they get, they don't know they're having finger also they're putting in, they're scratching it. So all those things are not hygienic, and it can unnecessarily create more complications. Similarly goes with the throat. When you are having the sore throat and all, try to use as much the warm water, and sometimes you do the gargle with the bit of salt. Use certain types of maybe the strepsils and all if you feel there is too much of problem. So you can use some things. Otherwise, the ginger is one of the best things. Honey, lemon is one of the best things. Mix with the warm water and drink. And avoid all those oily food and cold things.
Milk also shouldn't drink.
Milk will trigger the mucous membranes majority of time. So can try those dairy products which is directly killing, or the sugary products which is directly killing to you or giving the more problems. Right. So, these are some valuable informations, or I can say the do's and don'ts when you are suffering with ENT problems. And homeopathic medicines quite commonly, as one of the medicine I mentioned about the pulsatilla. Then there are some medicines which works very good for the sore throat and also the fever. So like belladonna.
Belladonna.
Belladonna 200 potency. It can be just given when there is a tonsil pains or tonsillitis and all. And immediately 2-3 doses it will be sufficient to subside the overall conditions. Especially in children cases. And if the child is suffering really quite commonly, and especially the young children who are having the developmental state, so there is a medicine called Baraita carb, which has been given time to time to control all the glandular swellings.
Okay.
Like they have submandibular glands, they have parotid gland, they have thyroid gland, all those glands whichever are getting, all the lymph node swellings and all, very common in children when they are getting infections. So we can use that Beretta carb. Furthermore, there's Phytolacca. So these are the common medicines which have been prescribed for such type of ENT problems.
So do you encourage people to just hear the names and then they buy the homeopathy medicine themselves and they do it themselves? Is it DIY?
Okay. Actually, we do have certain courses where the DIY conditions can applied.
Okay.
And like we do encourage mothers or the parents to keep 10-20 remedies as a kit box. We do also give the few hours training for that.
Okay.
Because understood that homeopathy is not very well prevailed everywhere. So you can't find the medicines even though I'm telling the name here.
Yes.
Right?
Yes.
For the knowledge base, I have given the name. If people are interested, they can open the book, write resources from even the internet or from the manual, and they can study about it. So they will be more confident. The purpose is about that.
Yes.
But I do prefer if they keep some medicines at their home and at least treat their children's precautions. Treat their children at bedside.
Yes.
And then if you have still complications remain, so then I can help it, or homeopathic doctors can help it.
Yes.
Right?
That's good.
Yeah.
That's good.
So I think Shrub, the topic definitely is very warm and very, very hot, and it can go on.
And now it's rainy day, a lot of people running nose.
Yes,
that's just nice.
Yeah. So weather is also supporting to the topic.
Yeah, cold and rainy.
So I think with that, I think we will try to conclude today's topic.
Yes.
Yeah. Would you like to give any tips, 1 or 2 tips for the PND?
How I think I tried the pot if you are daring, and it is quite good. The feeling is quite good, very soothing. You put the salt water into your nose and enter into to right nostril and then come out with a left one, and you feel very good. Immediately I encourage people to try to do that if you can.
Very good. Yeah, definitely.
Go to some training, then you can do it.
Yes, do take care of the training part.
That's right.
So as we are getting expert, you can use without any hurt to your child, and faster you can open the blocks.
True.
Nasal blocks.
Nasal block, yes.
Right. So with that, I think Shrub will come up with a new topic soon for the next week.
Yes.
And I really appreciate your time to be here with us.
Yes. See you guys next time.
See you guys next time. Thank you so much.
Okay, bye.
Bye-bye.
Bye-bye.